I'm going to start by coming into the room, washing my hands, introducing myself, and explaining what we're going to be doing today. My name is Makisha. I'm a graduate nursing student at the University of Texas at El Paso, and we're going to be performing a physical assessment today. To start, I'm going to start by observing my patient's mental status. Could you tell me your name?
My name is Michael.
Could you tell me where we are?
We're at the hospital.
What hospital are we at?
Skyline.
Perfect. Okay, could you tell me what today is?
Today is February 24th, 2017.
Perfect. I'm also going to observe my patient's appearance, cognition, and emotional stability. I'm going to look at his body language, his grooming, his attention span, his mood, and his thought process. Okay, I'm also going to observe his posture, his gait and balance, as well as his speech and comprehension. Okay, please listen carefully. I'm going to give you 3 words and just try to remember them and repeat them back to me, okay? Banana.
Banana.
I'm sorry. I'm going to give you 3 and then repeat them back.
Okay.
Banana, sunrise, chair.
Banana, sunrise, chair.
Perfect. Thank you. I'm going to start by inspecting the head for hair distribution and skull size. I'm going to then palpate the head for shape, symmetry, or any tenderness. Next, I'm going to just have you look at my nose, open your eyes wide, okay? I'm going to observe the eyebrows, the eyelashes, and the eyes for position, shape, and muscle balance. Okay, next, I'm going to check your visual field, okay? Just let me know when you're able to see my fingers.
Now. Now. Now.
Perfect. Okay, next, just focus on my finger without moving your head, okay?
Mm-hmm.
We're going to check your extraocular movements, which exhibit cranial nerves 3, 4, and 6. Perfect. Okay, next I'm going to have you just focus at a point on the wall. I'm going to use my pen light here to simulate an ophthalmoscope. Okay, and then I would inspect the eyes for pupil reaction, retinal color, blood vessels, or any lesions. Okay, thank you. Okay, next I'm going to just have you look up. I'm going to pull down and inspect the conjunctiva. Okay, close your eyes. I'm going to palpate the eyes and lids for any nodules. Okay. Lastly, we're going to test your visual acuity, which is exhibiting cranial nerve number 2, okay? What I'm going to have you do is take this Snellen chart and read the smallest line that you're able to see.
T, C, D, E.
Perfect. Now, will you cover your right eye and repeat?
T, C, D, E.
Okay. Now cover your left eye and repeat.
T, C, D, E.
Perfect. Thank you. That concludes our eye exam. Okay. Next, I'm going to inspect and observe the outer ear. I am going to look for any swelling. And then I'm going to palpate the auricles and the tragus, noting any tenderness. Next, I will simulate with my pen light using an otoscope to visualize the external auditory canal and the tympanic membranes, noting any discharge or foreign bodies. Okay, next we'll perform a few hearing evaluations, okay? I'm going to stand behind you and just repeat what you hear me say, okay?
B, G, T, C. F, H, G, A.
Perfect. That is exhibiting cranial nerve number 8. Okay. Next, we're going to perform the Weber hearing test, which is going to check for unilateral hearing loss. Okay. I'm going to simulate using my tuning fork, and just let me know if you hear the sound equally in both ears or better in one ear, okay? Great. Okay. Next, we'll move on to the Rhine test, which is going to check for bone and air conduction, okay? Just let me know when you're no longer able to hear the vibration.
Now.
Same thing. Repeat.
Now.
Repeat on the other side.
Now. Now.
Perfect. Thank you. Okay, next I'm going to inspect and palpate the frontal and maxillary sinuses for any swelling or tenderness. Okay, now I'm going to check for nasal patency. Could you just occlude your right nostril and breathe in for me? Okay, could you occlude your left nostril and breathe in? Okay, next I'm going to simulate using the otoscope to visualize my patient's nasal mucosa, septum, and turbinates, noting any discharge or swelling. Open your mouth wide for me. Next, I'm going to inspect the mouth, simulating my otoscope. I'm going to inspect the lips, the teeth, the tongue, the buccal mucosa, and the tonsils. And then following that, could I get you to stick out your tongue? Move it side to side, which exhibits cranial nerve number 12. Next, I will simulate using a tongue depressor to test the gag reflex, which exhibits cranial nerves number 9 and 10. Okay, next I will palpate the lips, open wide for me. Palpate the lips, the teeth, the cheeks, and the tongue. Any pain there? Good. Okay, next I'll check a few facial expressions for cranial nerves number 5 and 7. Could you lift your eyebrows for me? Open your eyes wide. Puff your cheeks. Stick out your tongue. Clench your jaws. Perfect. Thank you. Okay, next I'm going to observe the range of motion in your neck. Could you bend your neck from side to side? Could you rotate your neck from left to right? Could you rotate your neck frontward and backward? Okay, and lastly, I'm going to have you shrug your shoulders, which exhibits cranial nerve number 11. Perfect, thank you. Okay, could you swallow for me? Okay, I'm going to inspect the neck while swallowing, noticing any difficulty in assuring that trachea is midline. Then I'm going to palpate the temporomandibular joint. Could you just open and close for me? Okay. Then I'm going to palpate for lymph nodes. Noting any firmness or any nodules or any tenderness. Okay. Again, palpating the trachea for alignment. And then we're going to palpate the thyroid gland, noting any masses or tenderness. Okay. Next, I will first inspect and then palpate and auscultate the carotid arteries. I'm going to palpate, which I completed, and then auscultate, noting any bruits. We want to perform that one at a time, as so not to cut off the blood flow. Okay. Next, I would inspect the chest for thoracic landmarks, noting seeing symmetry as well as color. Then I will palpate the chest. First, I'll evaluate respirations. Evaluate respirations for the rate, the depth, and the pattern, noting that it should be even and unlabored without any accessory muscle use. Okay. Then I'm going to palpate the chest for symmetry and tactile primitives. Okay. I'll come back behind you. I'm going to palpate for symmetry. Okay. And when you feel my hand touch your chest or your back, just say 99 for me, okay?
99, 99, 99, 99, 99, 99.
Okay. The same on the front. Just palpating symmetry. Okay. Repeat.
99, 99, 99, 99.
Okay. Perfect. Okay. Next, I'm going to percuss the chest and the back for tone as well as pitch. Okay. I'm just going to place my fingers to the back. You'll feel a bouncing sensation, okay? Come around and do the same with the front. Okay. Next, I will also take breath sounds. Just take a deep breath in and out for me every time you feel my stethoscope. Okay. Go back and repeat on the back. I'm also taking these breath sounds for quality, and I'm noting any abnormal breath sounds such as crackles, wheezes, or rhonchi. Next, we will be moving on to our cardiovascular assessment. I'm going to simulate that my patient's chest is bare. I'm going to inspect the chest for any pulsations and the point of maximum impulse. I will palpate the patient's chest, noticing any thrills or heaves, including the intercostal spaces. Okay. Then I will auscultate the 4 points of the heart, including the aortic, pulmonic, tricuspid, and mitral areas, noting the normal S1 and S2 sounds, as well as noting any murmurs or any S2 splits. Okay, then this portion of the exam, I'm going to just talk through what a breast exam would look like for a male or for a female. We would inspect the breasts for their size, their symmetry, or any lesions. I would then inspect the nipples and the areola, noting that they should be fairly smooth without any cracking or discharge. And then I would then palpate the breast, palpate the axillary regions, and palpate the lymph nodes, noting for any masses, any inflammation, or any tenderness. Okay, next we'll move on to the abdominal exam. If I could just have you lay back. To that side, maybe that will help. Okay, that looks good. Okay, I'm gonna pull your covers back. Could I get you to lift your gown above your abdomen? Okay. First, I'm going to start by inspecting the abdomen. Be sure that I'm noting any aortic pulsations if they were there. Okay, next I'm going to auscultate the abdomen, including all 4 quadrants. Auscultating the quadrants of the abdomen, noting that they're good for bowel sounds. Okay, next I'm going to percuss the abdomen for underlying organs. On the right, we expect the liver. On the left, we expect the spleen. And we're assessing for any masses, any tenderness, or any enlargement. Okay, lastly, I'm going to perform some palpation. I'm going to start with light palpation, then it's going to go a little bit deeper, okay? If at any time it's really painful, just let me know, okay? How's that so far? Fine? Okay. How's that? Fine? Okay. Okay, for this part of the exam, I'm going to just talk through and simulate. You can go ahead and sit up, Mr. Michael. At this point, I will perform the male genitalia exam. I would inspect the pubic hair for distribution and inspect the glands of the penis. I will palpate the penis for any masses or induration or tenderness. I would then inspect the scrotum for asymmetry or any lesions. I would palpate the testes, noticing any tenderness or masses as well. And then lastly, I would palpate the inguinal lymph nodes, noting any nodules or any tenderness. Okay. Could I get you to swing your legs around? Okay. Just hold your hands and arms out for me. I'm just going to inspect the hands and inspect the arms, noting the hair distribution, the color, or any present lesions. Okay, I will palpate the fingers, the hands, the arms, and the elbows, noting the temperature, skin turgor, and mobility. Okay, I will then check the nail beds and assess capillary refill. Okay. Next, I'll just check for upper extremity strength. Okay, just squeeze my hands as hard as you can. Okay. Now make a fist and push against my hand. And then pull against my hand. Great upper extremity strength. Okay, now hold your hands up for me. Okay, now just let me know if you can determine the letter that I draw on your hand, okay? Without looking.
A. X.
Okay. Good job. Okay, now could you tap your fingertips to your thumb for me and repeat back and forth. Very good. Thank you. Okay, next I'm going to inspect the legs, looking for their color, the hair distribution, and noticing any scarring that may be there. I'm going to palpate the legs for temperature. I'm going to palpate the joints for any swelling. Okay. Then I'm going to palpate the feet, the legs, and the ankles, noting any peripheral edema. Okay, now I'm going to palpate the pulses for rate, rhythm, and quality. lift your legs up for me a little bit. Okay. Could you stick your arms out for me again? I'm also going to palpate these peripheral pulses for rate, rhythm, and quality. Okay, next we will check for the strength in your lower extremities, okay? Could I get you to lift your left knee toward the ceiling? Perfect. Okay, now repeat with your right knee. Great. Okay. Now could you point your feet and push against my hands? Good. Okay. Now flex your feet and pull against my hands. Good. Okay. Now could I get you to lift your left leg as far as you can get it to go? Okay. Any pain? Okay. Repeat with the right leg. Good deal. Okay. Now I'm going to simulate assessing your reflex. I'm going to simulate using this as a hammer. Okay. I'm going to check your knee, so you know how it works, right? Good. Okay. And the back of the feet as well. Okay. Great. Okay, thank you. Next, I'm going to have you stand for the rest of our musculoskeletal exam. Just stand here, face the wall, and stand with your shoulders about stand with your feet about shoulder width apart. Okay. Go forward a little bit for me. Okay. Now I'm just going to visualize the spine for alignment. If you're able to, can you bend over and touch your toes? Okay. I'm just going to palpate the spine for curvature. Okay. Have you stand. Okay, you can stand back some. Okay, could you bring your arms up to the side? Okay, now bring them back. Bring your arms back behind you. Like pulling them out behind you. Okay. Now bring your arms over your head. Okay, now bring them out in front of you. And curl. Curl your bones. Perfect. Okay, now for the test. What were the 3 words that I asked you to remember?
Banana, sunrise, chair.
Perfect. Okay, that concludes our physical assessment. Thank you, Mr. Michael.